I first met Doug Adams in Paris through the Winback Academy. At that time, Run DNA was still young, and I was most impressed with his focus on gait and running. And over the years, I've been even more impressed because of his commitment to education. You'll see that Doug is very dedicated to enhancing athletic performance using a lot of innovative technology and personalized training solutions. He's got a great background in sports science and biomechanics, just passion for helping athletes at all levels, really so well-rounded in running, and you'll see. So, Doug, I can't wait to hear your talk and what you're about to share tonight. So please put your hands up in the chat for Doug. Thanks, Doug.
Thank you all for having me. Thank you, Winback. Everyone on the panel here today, really appreciate you having me out. Winback has been something that's been a really pivotal part of my practice. So it's fun to just have a chance to, like you said, interact with that community and get to speak to more people about that. And I'm a very interactive presenter, so I love when people speak up and share their thoughts and ask questions and things. So I'm excited for tonight for that. So if it's all right, if we're ready, I'll share my screen here.
Sure,
and
take it away.
Jump in. All right. This is just fun for me to talk about here. We're talking about two of my passions here, running and technology. So bringing these two together and talking about this is just a fun thing. And I really, as we were kind of saying, my background started off really in education. I started off at University of Delaware for my PT school, and I got to the point where I was doing a lot in the academic world and started publishing and did a lot of work on ACLs early on, actually, and had a chance to get great mentorship from Irene Davis, Rich Willie, and Lynn Snyder-Mackler, and we talked about all things gait and sports rehab. But then I got out of the academic world. I got pretty frustrated pretty quickly with not being able to get the same kind of results, not having the same time with my patients, and some challenges there. So really just went back to the board and said, all right, how do we get results quicker, faster? And we started actually teaching a lot of education. And we started saying, how do we evaluate the runner? How do we do this? And found a really good response to that course, which now we've had over 10,000 people take those courses. But we've saw that we kind of did it backwards. And then we said, well, great, this is really helpful information, but I really want more data. And then we kind of became a tech company on the tail side of our education saying, well, now we know how to evaluate them, but how do we get the best data? And really, like, what Run DNA is about here is we're a company that exists to help people to live to be 100 years old, happy and healthy when they get there. We call it our 100 Happy Healthy mission. And the way that we do that is we really feel that there's taking a movement-based approach to health is the way that people can get the most out of the activities that they love. So we provide education and technology for medical and fitness professionals just so that they can help other people really deliver on that mission of 100 Happy Healthy. And that's, as we're starting to think about it, technology is a big part of that. And I think in modern healthcare and fitness, we really need to be thinking about how we are leveraging technology. The technology is accelerating so quickly now that if you are not considering technology, you are going to be left behind because your competitors are using it and it's getting results better, faster. And that's what people really want. So when you're thinking about, should I incorporate technology into your practice, you have to think about how is it going to help you? And these are three main areas that I consider, and other people might have things that they're looking at as well. But one of the first things that I look at is, does it enhance my capabilities? Can this help me get people better faster? Can it help me get better results? And that might be through diagnostic, maybe like doing a gait analysis. That might be through treatment, like getting improved blood flow, like with Winback, and getting the pain down and the tissue function and the healing faster. So how am I enhancing my capabilities is kind of the first thing that I look at. But then the other things I really need to consider too when I'm picking technology out is, how is this going to help me build trust and confidence in my patients? Because a lot of times people are coming to us and they're very skeptical. They said, oh, I've tried physical therapy before. I've tried chiropractic. It didn't help me. Like, what are you going to do that's so different? And when you are utilizing technology, it really helps to get their trust and show that you have this extra knowledge, this extra skill set that your competitors might not. And it's going to help you get better results because they have better trust in you and they're more likely to do what you're asking them to do. So that's another important aspect of technology. And then finally, we're all running a business, so we need to see a good return on investment as well. So you want to see how this not only enhances those capabilities and builds trust, but can help you from the business side of things as well. So I think that's a really important part when we think about technology, is making sure that we're doing that. And I'm sure a lot of people are using some form of technology, low tech to medium tech to high tech. So, I don't know if I can really see the comments while I'm presenting my screen here, but, to get some interaction here, how many people use a goniometer or a dynamometer in their clinic, right? People are looking at, and we're objectifying, let's objectify range of motion. Let's objectify strength in some capacity, right? I would ask you, my challenging question is, well, how do you measure gait? How are you measuring somebody's gait? Because my view on gait, whether it's walking or running, is that it's the most functional expression of our movement capabilities. It is the thing that almost everybody does that really assists us to make sure that we can see how we're interacting with the world. And it's pivotal to our overall health and well-being in so many capacities here. So what I ask people is, if it's the most functional and one of the most important things that we do, why aren't we measuring it? I think that's an important question that we should really ask ourselves about how the measuring can even help us with results there. So, and along the same lines, we know that we need to measure movement, but we also need to be able to affect change for things that impact movement. And we know that pain changes movement. So when we think about things like win-back and treatments there and technology that helps us there, how are you getting rid of pain quicker, right? For my practice, when people come to me, people fly from all over, they come to see me, they're not coming for 6 months. They're coming for a week or two. They said, I need you to get me out of pain quickly, and I need to get me moving well and even enhance my performance. And that's why I rely on things like win-back to really get the pain down quickly, because we know that's going to affect their movement. So we have to think about, how can we use technology to diagnose? How can we use technology to treat and get rid of pain quickly so that we can do our other fun things? And it's not that things like exercise and patient education aren't important. We have to be holistic in our plans of care and individualize. But I think a lot of time people rely a little bit too heavily on these things. And I'll, put up that little soapbox there that I think patient education and exercise are great. And there's things that really do work really effectively, and simple can be better. But it's also time to showcase our skills and our knowledge and make sure that we're really utilizing all that education that we paid for, making sure we're putting it to the test and enhancing our capabilities and getting that results both for us and for our patients there. So with that, one final word too, when people think about working with runners, there's a lot of people that say like, oh, I love to work with runners, but runners are cheap. They don't want to do anything. And my response to that is, runners aren't cheap at all. They'll spend $300 on a pair of shoes that they can run 50 miles in. They're not cheap. They're just value driven. So they're a population. If you've wanted to work with runners and you're like, oh, well, they're not going to pay for technology, or they're not going to pay for things. I have people that are more than willing to pay for it to keep running, but they're value driven. And if you're sitting there kind of saying like, oh, I think I see this when you run, or you're kind of busting out your phone, it's like, oh, it looks like you're doing this. That's not that impressive to them. So as we're thinking about technology, kind of the purpose of this whole talk and how to use technology for running sports medicine specialists, I think it's important that we consider that there is value-driven participation by the clients that we want to work with. So for the rest of the talk, that's just kind of like an introduction, why we're doing this here. But we're going to start getting into more of the didactic, the running biomechanics and those types of things, and start to talk about that, the role of gait analysis and in optimizing patient client outcomes, and really the benefits of technology and how I utilize technology in my own practice, and give you some examples, and even talk about some of the settings that I use when I work with win-back, some of my own personal stories, both for myself and for my athletes, of how it saved me quite a few times here. So Let's jump in and start talking a little bit more about runners and injuries here. So this is the most wordy slide I really ever use here, because I think it's great. We want to be evidence-based. And this is an article that came out in 2017 and something that was just really agreeing with what we were teaching in our courses and our philosophy with it. The fact that, like, why do running injuries happen? We have to really ask ourselves, right? Because somebody might say, well, they happen just like any injury because the stress exceeds the capacity of the tissue, right? But if we look at it a little bit more and try to understand it, they have this Bertelsen article from 2017 that says, we hypothesize the injury occurred as a result of the runner possessing multiple risk factors and then participating in running under certain circumstances to a degree where the structure's load capacity was exceeded. So that's a lot more eloquent way of saying, stress greater than capacity, right? But when we dissect that statement, we start to think about the fact that they possess multiple risk factors. And a lot of those risk factors happen even before they start running. So cumulative load, cumulative stress, and then things like their form, the forces that are acting on the body. Those are, we enter into this with a certain amount of capacity, and then we put a certain amount of stress on the body. And when we exceed that capacity, that's when we get injured. I use a car analogy a lot for this, right? If you're starting a car race and you've got a quarter tank of gas, you're not going to get very far in that race. And if you've depleted your body either because your training load is high or your tissue capacity low or the stresses are high from faulty mechanics, that car is going to break down even quicker. So you really need to make sure that we're understanding that multifactorial nature and then realizing that not everyone's created equal. A big thing that we really stress is the personalization, where we have to say, we have to understand that runner that's in front of us. We need to look at them as a whole, and we need to understand all the different things. So we have, throughout our certified running gait analyst courses and our certified walking analyst courses here, we show that we need to assess, and we use a series of assessments. So for runners, we use a runner readiness assessment as a way to address mobility and motor control. So this is, if you've ever used FMS or SFMA, this is a runner specific version. That's a 6 to 8 minute of that. That is similar. It's very different tests, but it's a way to look and understand before you ever get somebody on a treadmill, what do they look like? What are their movement capabilities before you get them on? But we also have to look at other things like their ability to generate power. We look at the loading levels, which is how we prescribe plyometric type activities. We look at their running form, whether using 3D or 2D. We look at that. We also consider their strength, and we consider anything specific to the patient or specific to their diagnosis for the reason that's bringing them in. And we have to get those holistic plans, and that personalization behind it is really key. Now, that's important, but you're probably starting to think, man, how do I assess all of those things in one session? And that's where really having a systematic approach makes a huge difference. That we want to make sure that when we're working with athletes, that we're not missing critical elements. I give an example of saying you watch somebody run, and I'll explain some of these categories in a second, but one of the 5 categories of runners that we have is this collapser. And everyone's probably seen this person where their knees are coming together, the hips are dropping, and we see they are losing the frontal and transverse plane battle. They are just all over the place, and we call this person a collapser. And the reason that we need to have a holistic view of this person is because what if this person comes in, your first thought is probably what? Maybe they've got weak glutes. Maybe their core stability is poor. They have poor just balance and stability in general. What if that same person actually has limited ankle dorsiflexion mobility? And the only way that they can accommodate to the forces is by externally rotating and pronating at the foot. So now, because of that miter hinge at the ankle joint, now their knees are coming in together. And you're going to tell this person, and you're going to do all this hip strengthening for this person, and you're going to get nowhere because the reason that they're collapsing is because they actually have a stiff ankle. So we have to know and be able to apply that personalization. And that's really what we've come up with, are these fundamental ways to get that holistic approach where you're giving somebody, here's 2 exercises for mobility, here's a gait cue and one drill to do before you run. And that's going to get huge benefits for them without taking a lot of time. So we have this systematic approach that is a series of assessments. The 5 categories that we have, we'll review one of them now because it's probably the most common one. I'll get to that last before we transition to the next slide. We talked about the collapse already. The weaver is somebody who has a very narrow base of support. So they're often, because of potential balance or stability issues, they want their foot to be closer underneath of their center of mass. And then that puts stress on the lateral structures. So somebody that's having perineal issues, somebody that's having IT band issues might be a weaver there. We see the bouncer, somebody who has excessive vertical oscillation, somebody that's going up and down. So with physics, we're seeing that person is going to have higher forces just because they're displacing a lot upwards instead of forward. We need a certain amount of balance, but we don't want too much. And then finally, our glute amnesiac here is a person that is just taking their butt for a run. They're leaning way back. They're trying to reduce the stress on those glutes, but it's a trade-off, and they're just shifting the load to the front of their knee there. So then the other category is probably the most common, and that's why I saved it for last here, is the overstrider. So we've probably all seen this too, the person that's landing way out in front of the body. So when we see this, we're going to take a look at this here. We define this based off of a few different variables. We look at the angle of their shin, their foot, how far their body's landing in front of them, and we look at some of those things. And if we just, let's see if I can stop this video at the right time here. Yeah, so if we look at this video here, this is our 3D software that we're looking at, and I'll play it again so you can watch it. But we just look at that, and you can see that that's a tough position to land in, right? The foot is landing way in front of the knee, and then we're seeing that the foot is also at an aggressive angle up, and we're far from our center of mass, how far we are in front of the body. So that's going to put a lot of braking and horizontal stress on our body by just slowing down between every step. And I'll play that again so you can just kind of watch it and see it in real time. But that's a very common thing that we see, and I don't want to blame shoes, but I'm going to kind of blame shoes here a little bit, that if people don't have the negative reinforcement of the shock and the impact there, then they can have lazy mechanics this way. And a lot of people say like, oh, I run naturally, I optimize the way that I move. Well, maybe if you're running barefoot from birth, you're going to optimize some of your movement there. But as we start to alter our environment and alter the conditions that we experience with the environment, we're really going to see that we're changing our movement patterns. And we do need to look at the way that we move. And we need to try to impact that and reduce some of those stresses that we know are going to contribute to injuries. Because we can change it quickly. And now we're seeing here, gait cues can make a big difference in a short amount of time. So if we compare this, what we saw before to what we're seeing now here, and I'll see if I'm going to move this around a little bit. Now we're going to see at initial contact, the change in position here where the shin is nearly vertical, the foot is nice and even with the ground. This was 2 minutes between these two videos. It's just understanding the right cue and being able to cue somebody how to do that and how to change their position and their posture when they're going through different phases of the running gait makes a huge difference, because people have no clue. A study that's often cited is that they asked collegiate and masters runners, or very high level runners. They said, well, do you land on your heel or do you land on your front of your foot? And less than 50% of people could even guess that right. So they have no clue what else is happening with the body. And as movement specialists and medical and fitness professionals, we need to be able to give them advice. So then what we go into is, well, what cue would you use for this person, right? Do you just say, stop that? Do you just say, don't do that anymore? We have to think about the cues and how we can use different things. So, maybe you can put some suggestions in the comments, but just in the sake of time here and video-based instruction, a lot of times people will suggest, well, cadence. Cadence can be something that we can suggest that might help out with that. And there are certain people that do benefit from cadence. Now, I've done over 3,000 3D gait analysis, and I can tell you that cadence works about 1 in 5 times. So it's a great starting place for somebody, but rarely does it change their mechanics in a significant way. Although there can be some benefits to it, it's not something that always changes the mechanics that we're looking to address. And you might kick the can down the road a little bit and allow them some time to reduce the stress in the short term. But running injuries have a 4 to 6 week delay. So what you're doing is just delaying the inevitable by not addressing some of the mechanics that way. So it's part of
Doug,
yeah,
all this stuff, great stuff. So let's take one step back. 'Cause there's
yeah,
essentially two demographics we're looking at. We're looking at the banged up runner who's
yes,
got pain, who can't get past their 12-mile run or 40 miles a week,
yep,
or when they do hill repeats, their knee goes, their IT band flares up, versus the performance enhancement runner, the guy
yeah,
that's not getting banged up, that wants to just perform better. So I understand the concepts apply to both, but
yes.
at what point, I mean, an overstrider might be the way to go for a sprinter. Who's trying to break 10-second 100, right?
Right. Well, let me ask you a flip question, right? So because we get this a lot, right? So let's say you have a baseball pitcher and you see that when they pitch, their elbow drops below shoulder level. And we know that that puts a ton of stress on the UCL. Would you change the mechanics
Depends on how fast they're throwing and if the ball's getting over the plate.
if they're getting over the plate? Most people would probably change those mechanics, right? What we're saying with a lot of this is that same on that performance side, they're not injured yet, but the structure's capacity can be exceeded for any number of reasons. Let's say somebody travels to a race, right? They're doing their first international competition and they've been training, they're fine. And then with the same faulty mechanics, they go out and run after being jet lagged. And all of a sudden they get injured and they're like, well, why do I always get injured at race day? Well, your structure's load capacity is diminished there with it. So my stance is that we really should look, there's no perfect running form, but when we see these 5 categories, we know that those place they place limitations on performance and they place increased risk for certain injuries. So we should be addressing them even in the performance standpoint too. I can tell you from personal experience, there's a lot of American record holders that have benefited from some of these analysis and looking at it from a performance standpoint, where we do have to make the call. And like we said, we're looking at a personalized program where I might say, hey, your biggest gain is going to be from doing a strength program. I'm not worried about your mechanics at this point in the season. And I might stage when I change their mechanics and say, hey, it's off season, let's deal with some of this stuff now. So it's not that we have to address all of these things at once, but I think in general, people are shy about changing some of these mechanics. And I would stress people that if you can collect good data and you understand some of the principles, that it can make a huge impact on the outcomes that people see. Yeah. Yeah. So this is, there's actually 12 categories of this. This is just one of them. So you can see we got a lot to talk about in the courses here. There's a lot of details to go into it, but the trick with it is we also know concepts like strengthening doesn't change movement patterns. And we also know that flexibility or mobility doesn't change movement patterns. There are countless studies showing that, hey, this one's a great one by Rich and Irene, two of the people that I mentioned that worked with at University of Delaware. They said, let's increase everyone's hip strength and measure what their running form looks like. And they measured them after and they said, wow, everyone's hip strength went up. And then they looked at their running and said, wow, nobody's running changed. Their running is just the same there. So we have to train the movement as well, because strength training activates different areas of our brain than skill training does. And skill training leads to cortical reorganization that strengthening can't. So, when we think about it, we have this drill that we're kind of showing here. Running is a little challenging when you think about it, and it's a very highly skilled activity, but it's very different from something like golf or even baseball or tennis, right? Golf is something that's a discrete movement. there's a discrete start and end to it. Running is a continuous movement. So there's no definitive start and end. You're going from one gait cycle to the next. There's no pause in between. So if you want to train somebody's golf swing, you can work just on an element, taking up into the backswing and focusing just on the wrist position or the shoulder position in that. But it's pretty hard to do that in the middle of somebody running through the air, is having that. And that's where drills really come in. And we need to use drills to teach people positional awareness and what our goal is while they are doing the running. So that's a really important part, is understanding what these running drills are and how to incorporate them into the plan of care. Each of those 12 programs that we have has specific gait retraining drills and specific cues that we use to try to get people to understand the posture and the movement position that we want them to be in there. And remember with this stuff, and kind of Don, to your point even as well, we don't have to necessarily make them perfect with this. This is one of my favorite studies here that shows that they're talking about bone stress injuries, but there's a great quote in it that a 10% reduction in the stress of each step lets a runner go twice as far before the body breaks down. 10% is extremely achievable. That is something that if you understand what 10% to focus on, it can be very effective. And you don't have to go. And when I work with a professional, a first timer to a first place runner, I'm staging a lot of these things. And some of these things that we're talking about, I might stage it over weeks or months or years, trying to get them, depending on their level of competition, depending on what their goals are, what their movement capabilities are. I'll stage a lot of this and put it together as a plan of care. And I think that that's an important part, but it has to be part of the plan of care. And my whole mission is getting people to understand when you're working with runners. And I would also say that this isn't just applicable to runners. Almost every sport involves running. So we should be evaluating running and running mechanics for pretty much every single sport, because there's an element of running, whether it's for the training or whether it's for the actual sport itself. Running is a crucial part of that we need to understand. And if you can just reduce 10% and get them twice as much, why are you not doing this? Your return on this is so huge that it really needs to be part of both a rehab or injury prevention, but also a performance-based program, because it's not hard to get a big return on what you're looking to do. So kind of like I've been alluding to, there are 12 categories actually. We see these 12 categories here, and that is kind of a breakdown. You'll see there's subcategories within it, and we developed this with the military actually. So the software, we had developed the software in 2016, but by 2019, the military kind of got wind of it, and they've got a lot of running problems. So they came to us and said, we need you to do this, but we need to make it very easy. So we built algorithms in, and we evaluated all the runners that we had looked at, and we were able to actually kind of identify who did best with which cues. And we created algorithms that are able to give people specific cues. So when you see there's the overstrider cadence group, this identifies the overstriders that benefit from cadence versus the overstriders that might benefit from more knee drive, lean angle, looking at different hip positions. We have all these categories here, and we teach you all about the cues and how to do that stuff. But I could talk for literally probably days, not hours, about this kind of stuff. So that's a big part on the running side too. But I also want to say that walking gait really matters. And even from a sports medicine perspective, I'll give you my own story about this. I last summer partially tore my patellar tendon, and I was rehabbing that. And I was in 9-10 months into this process and making gains where I could get to a certain amount of running volume, but I would pay for it. I would have some downside to it. And then we were developing our new walking analysis, and I was one of the early guinea pigs testing it out. And I started noticing my walking gait was off. And I was totally focusing on my running, and I wasn't paying much attention to my walking. But as soon as I realized that I was off on my walking, about 2 or 3 weeks later, I was running pain-free. because the overall load matters, and that structure capacity going into the activity really matters too. So we also know this for things like post-op ACL, ankle sprains. If you ever have that unilateral low back pain patient that constantly, like, you do great treatment for them and they feel amazing, and then about, they wake up the next day and it's Groundhog Day. Gait is a crucial part of that. If their gait is altered and you're trying to fix something with their back and they're not changing their gait, you are fighting a losing battle, because they are just going to lather, rinse, repeat for the cause of it. And we really need to look at that. So field hockey athletes, right? Or any more like unilateral or single-sided athlete that's having that unilateral back pain, man, walking gait is so important with that too. So we do have that same kind of thing, and I've talked a lot already, and I'm gonna go through a little bit of this, but maybe not as much as originally planned here. But we have to understand the walking mechanics really well too. And I think a lot of people will look at walking and just assume that because everyone does it, it's pretty simple. But when you start to dive into the complexity and start to understand, well, what are the kinetics and what are the kinematics going on? And how is that, why are we walking that way? What is efficient about this? Like, why do we have the kinetics where at certain points the forces are in front of our knee versus behind our knee? Why are we having 2 periods of double limb support? What is the role of that? What's the role of each muscle group between each phase, and how do they contribute to that? That's a lot of what we cover in there, and then break it down into the different categories where we have to understand the kinematics too, to say, hey, the hip's going to be in 20 to 30 degrees here. We want the knee at initial contact to be 0 to 5 degrees of flexion there, and we should see 15 degrees at the ankle, or a neutral ankle position relative to the ankle joint there, and just understand how the forces and how our body contributes to it, so that when we're rehabbing somebody, we understand why are they compensating this way, or what compensation might they try to enact that they'll later pay for. So the walking gait is a huge part of that, especially early on in the rehab process. And we talked about this a little bit before we got on, but the kinetics are a really important part of this too, and understanding just the forces acting on the body. So when we think about the kinetics, there's different kinetics for running and for walking, right? When we first hit the ground reaction forces, this blue line, are fairly low because we're in a period of double limb support, right? But as we move to single leg stance and we try to raise our center of mass, we start to put more pressure into the ground. And now we'll see that we get up to 110 to 120% of our body weight. But now by, that mid stance period, as we're going down, we see that we're slowing down the rate of how quickly our center of mass is rising. So we don't have to put down our foot into the ground as much. So the forces dip back down below body weight. And then as we move towards push off, we're now starting to take all of that stored energy and start to put it into kinetic energy, and we start to propel forward, and we're starting to push through the ground again here. So we need to slow the downward movement of our center of mass, and then we start to move into double limb support again. So understanding kinetics like this makes it a huge part of understanding the rehab cycle, to understand, well, hey, this person has diminished plantar flexion strength. Where are they going to absorb those forces, or what might happen to the forces, or are they going to be in a period of prolonged double limb support because they're not able to generate as much propulsive force, or not able to generate as much swing limb advancement? So why does somebody's hip flexor hurt because they have weak plantar flexors? Well, because the plantar flexors actually contribute largely to swing limb advancement, more so than propulsion at the late phase of gait. And if you're not able to get that swing limb advancement from the plantar flexors, you're going to have to utilize the hip flexors a lot more. So when you understand gait mechanics that way, you can really put it together and design very personalized and very comprehensive plans of care for your athletes that you're working with. And walking really does matter too. But what point, right? To Don's point and to some of the others, like, how do we know that they're ready to do gait retraining? We really do have to have an understanding of pain. We have to make sure that they have enough adequate mobility to ask them what we're doing. That collapser, if we're trying to change their collapser mechanics and I haven't given them that ankle dorsiflexion mobility yet, or they haven't achieved it with their home program, then they're not going to be successful. And we have to really understand, do they have pain under control? Do they have mobility? Do they have motor control? Do they understand what we're asking them to do? And do they have that desire to change? And when you have those variables together, then gait retraining can be a very important part of the plan of care. Now, pain is number one on that list, and we really have to think about pain with this. So here's a great story of how I got a lot more involved in the professional running community. So this is Drew, and Drew's become a really good friend, but Drew was the record holder for the mile in high school. You know, he was 3:57, I think, ran for the mile in high school, which is just impressive. And it just a really great human being, but also a really great runner. And when we met, he had bilateral femoral stress reactions that were really probably fractures. But we were calling them stress reactions to give it a chance. And he had 2 weeks to a major televised race that was a big contract event for him. And he said, I got to run. I'm coming to Delaware. You got to get me better. And we did a combination. The win back was a huge part of this, of getting him to come here to advance his healing capabilities, because I was putting him through gait retraining. I was doing these things. I needed to get his pain down quickly. And with 2 sessions, his pain was almost gone. And he ran pain-free on televised track meet there on NBC, showing like he was able to run pain-free with this there. And his training wasn't great, so it wasn't a great race, unfortunately, for him, because we had to do so much that his fitness declined a little bit there. But he was able to run pain-free. And those are the kind of results that we get. And that's when you want to work with athletes, you have to utilize the technology that's going to help you get those results faster. So some of the other things that I think I've really seen just to be amazing, honestly, with the win back, this is one of the biggest ones, this athletic pubalgia or the sports hernia that we hear about, or groin pain. I have to say, this is a thing that I kind of got known for treating with professional runners, because this is fairly common, because I could get them within a week back to running pain-free. And a big part of that was utilizing the win back, where I did a treatment regimen where I'm getting, you know, you have to be willing to be a little uncomfortable, but I got right over the pubic symphysis. And we did a treatment where we did CET for a few minutes at 40 to 50%. And then we did RET, and some of this was back in the, it was like RET plus, but there's some different settings now. But, you know, we really, the RET was huge as well, just because we're getting to some of the collagen and the bone, and really seeing if we can help out with that. And then I would put the bracelets on and do soft tissue massage for adductors, hip flexors, and quadriceps, just to try to alleviate some of the tension on the area. And a session or 2 of this makes a huge difference with those athletes, especially if you can get them in the early stages. I've had countless athletes that have come, they come to Delaware, they only need 1, maybe 2 weeks, depending on how much time they can give me here, where we can get the pain down. And this makes a huge, huge difference in their outcomes with it. The other thing I see a big difference on is with lateral knee pain. So again, doing, I kind of start with the CET, and I've got the back 4. So I'm getting the whole thigh. I can kind of work 2 wands there and cover a lot of territory in a short amount of time. So if you see that I'm only doing 3 to 5 minutes, it's because I've got the capabilities of the back 4 to do a lot of this, which makes a huge difference just for getting enough dosage in for it. And then I switch over to the RET with the high EMS and do another couple minutes with that. And I've got a video of that that's huge. And then I finish up with some soft tissue when they can tolerate a lot deeper soft tissue, because they don't have a lot of the hesitation, because the pain is significantly down. There's a good bit of blood flow to the area, so they can tolerate a lot deeper pressure from me. Whereas if I just go in there, I mean, I've got them screaming on the table and they're not very happy with me. So this is a way that I can get a lot more effective treatment in with it by using the bracelets as well. So, and here's just a video of what that looks like. This is me. I gotta say, my own personal experience, I am not a professional runner, more the weekend warrior there. But I hadn't raced for over a year, and I did a trail race, and I made the mistake of just bombing down a hill and just going so fast there with it. Well, fast for me, we'll say. That I developed some like lateral thigh and hamstring pain and lateral knee pain. And I was dealing with it, and I was on the road for a while. So as soon as I got back from my last conference, this was just this past weekend, I was taking this video. And after one session, it's like 85% of all that muscular tension is gone. It makes a huge difference with it. I found this to be a secret weapon just with dealing with that lateral knee pain, peroneal pain. I think this makes a huge difference with it. This is, I think, only for the back four. Correct me if I'm wrong on that, but this does make a huge difference in treating athletes as well. So, this, we talked about the gait analysis. I'm just going to breeze through this. If anyone's interested in gait analysis, reach out to me. We have a portable based system that is just, you only need 10 seconds, and it's designed for clinical application. So it pretty much goes everywhere you want to go there, which is nice. And you get the data quickly and instantly, and then it categorizes it and gives them a personalized program. So it's able to take the data, it's marker based, so that's gold standard. So you know that you're getting the most accurate data out of it there. And then once you get them on, you run for the 10 seconds, it can do it live or right away. And then they get a report telling them how they did. And then they get exercise programs teaching them exactly what they need to do. And that gets delivered to them every day through the Run DNA app. And it's there, and it's all taught in our education courses. So I found that this combo of technology where I can get the pain down with WinBack, I can evaluate them, I can work back and forth. It's just a winning combo. We've got a ton of our sites that, that for our 3D technology, we've got a ton of them utilizing WinBack as well, because they see the same winning combo there. And I just think it's huge to really be able to just say, hey, if you want to be known for working with athletes, you got to make sure you have the right tools with it. So there's a little discount for anyone that wants to learn more about our education. The QR code takes you to our education site, and WinBack 25 gets you 25% off through the month of October, I believe. So that was a lot of talking. Sorry, just to kind of go on a soapbox there, but happy to talk about any questions or have any discussion as well here. I like Jeff's comment about, as a runner, the only feedback I ever get on my form is when I'm chasing my shadow. That's great. Yeah. Yep. That's awesome.
Doug, that was remarkable. Really.
Thank you.
I'm still ever more impressed at, where you've taken this. I'm just so curious at working with podiatrists and, even in my own office using inserts or orthotics or pads. Tell me a little bit about your current thinking with that, where you're at.
Well, what's really cool is that new walking analysis that we did, because we have a score with it, we're actually able to quantify the effectiveness of those. And not only the effectiveness, but we can tell how it has an impact, and how are we shifting loads, and are we shifting it to an appropriate structure, or are we actually reducing some of the loads with that? And people are using this widely just to actually select which shoes are better. Podiatrists are using this as well. I just had a great conversation with a podiatrist in Louisville, Kentucky today that is using this technology of how they can help really fine tune some of this. The same thing in the orthotic and prosthetic world. So prosthetics, they're doing the same thing, understanding how changes are really making a difference. So we've got the scoring capabilities, but we can also see, hey, that was great. We reduced pronation significantly, but hip drop went down or went up by 4 degrees. So, we might be trading a back issue for a foot issue here. So maybe that was overly aggressive here. We can back off a little bit. So having objective data is so critical to that. And I think we have to be really willing to show our work and show that, hey, we did a great job with this. Look how great we did. Or, hey, I need to modify this, or this is where my clinical reason is going. And without the objective data, we're really taking a guess. And I think the objectivity is a crucial piece of that.
Great answer. Thank you. Are there any other questions? Now's your opportunity.
Hey, Doug, I have a question. I love the fact that you said that, not just runners have to run. Obviously, I've
Yeah.
worked a lot with the basketball and the WNBA over the last 23 years. And it's amazing to me, even with young female athletes, watching them try to play soccer, whatever the sport may be, and they don't even know how to run, and you're trying to
Yeah.
have them dribble and drive. And so when you're doing that analysis, like you just spoke about, is there a base off of speed? Because obviously we have sprint, we have change of direction with the other sport piece of it. How is that incorporated?
Yes. So a lot of times we evaluate at their self-selected easy run speed. And there's a couple reasons for that. With run training, if they're doing any sort of training for it, 80% of their volume should be at that pace. So it's the greatest opportunity to reduce some of the stress on the body. The other reason with that is that also it's harder to change mechanics when you're running faster because your exertion is higher. So what we see is if you can solidify the movement pattern at slower, easier speeds, it will start to transfer into the faster speeds. Because it's hard when you're sprinting all out to think about, well, what's my knee doing, right? You're just trying to go fast at that point. So it can be challenging to do that. But having looked at people at varying speeds, what we see is that they often do the same movement pattern, but the asymmetry or the magnitude of the discrepancy for gait gets larger. And if they were striking 32 centimeters in the front of their body and we want them to be 29 or less, when they sprint, they might be 36. But you probably have heard a lot of people say, I feel so much better when I run faster. Can you look at my form when I run faster? And the reason that they feel better when they run faster is because their ground contact time goes significantly down and they have less repercussions for that, but the forces go up. So the adrenaline goes up as well. So they're not as aware of some of it. And they're like, I think my form gets great when I run fast. Well, yeah, your ground contact time goes down, but your mechanics are still crap and you're still now putting high forces on it there. So we need to work on it at the slower speeds and teach people. I mean, we've had a lot of MLB players in for this as well. A lot of football players, wide receivers, NFL level that they need to work on just their slow running speed. And then they'll be able to understand and have more of an awareness when they go for faster sprinting mechanics.
Like what you hear? Leave a review of the show wherever you listen, and don't forget to subscribe so you never miss an episode. Run DNA helps runners and running specialists through education and technology to identify each runner's unique injury profile to avoid setbacks and maximize results. The Run DNA podcast is produced by Ace Running LLC. The Run DNA podcast is intended for educational purposes only. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can occur. Always seek the guidance of qualified medical professionals before making healthcare decisions. Find us online at rundna.com.